Thank you. I would like to start by asking you something. Let's imagine that we are not who we are, okay, for just a few seconds. And let's get into this little girl's body. And let's imagine that we are here. So how does it feel like? What kind of neighborhood she lives or we live? What kind of reality that she lives every day? What kind of dreams she might have, you know? What kind of future is waiting for her? And what kind of health she might have when she grows up, or what kind of health issues she might already have today. So health is one of the things more impacted by how do we look like, what kind of environment we live, what is my zip code. All of those things impact our health, not just our education and our income situation. So in the next 20 minutes or 15, 20 minutes, I will try to talk a little bit about some cold data about obesity, HIV, and depression, because those are some main issues, health issues in the US. We will take a quick look to social determinants of health. And finally, the three main community factors that impact health. So the goal would be to have a discussion and hopefully increase our understanding what are the root causes of health and illness. The depression is a serious issue, not just in adults, but in little children. Little children as young as 5 can be taking antidepressants already. So we can see in the white non-Hispanic community, 8% of the population suffers depression. In the black communities, 13%. Around the same 12% is with the Hispanic community. So that's one of the data that shows that minorities can have, we are all affected by these health situations, but the minorities in this first one can have one of the kids. HIV is another situation. So in this part, we have the male, and then we have the female. And again, we see the African American community. Those are numbers by 100,000 population. So we have almost 69 individuals with HIV, male. Usually male in this case are the ones who have the biggest numbers, and versus 25 female in the African American community. Hispanic are the second one with 28, 29 cases. This was data from 2007 to 2011. This is just in Wisconsin. Then we have the Asian community, and finally the white community. So again, we see minorities having the worst situation in terms of HIV. Third one, obesity. We have a couple, in this side, we have the overweight population and the obese population. The blue ones are the Latinos, red blacks, and green whites. What age are we talking about here, you think? What group?
I presume you're talking like from about 9 to 15-year-olds.
Okay, children, right? Yep. It's little ones, children 2 to 5.
Oh, wow.
So you can see that children 2 to 5, already 27%, almost 28 are overweight, and from those almost 15% are obese already, 2 to 5. And usually, but African American community is second and Caucasian third. Now the issue is that I brought this slide because there is a change in terms of obesity. Today we measure the adult population. African Americans are actually the number 2. Native Americans are the number 1. But usually Native Americans, they take them out of the graphs. I don't know why, but they usually get the 3 main groups. So that's why usually blacks appear to be the number 1. Actually, they are not the number 2. So the second one would be Hispanic community, but when we see the young population, there's a shift. So in the future, what we're going to see is that Latinos are winning kind of in the world with obesity. So and when we go to, in the case of teenagers, for example, again, you can see overweight Latinos are number one with 41%, almost half of the Latino teens are, and the same thing goes with Black Americans. So you can see that how, and in the case of the teenagers, 25% of blacks are obese. So in this case, how can we help families and help ourselves to be healthy? So community capacity building has been named as one of the ways to accomplish this. Many of the decisions have been taken top to bottom. So we see many people that are taking decisions for many more, and for many more who they don't even understand. They don't know their needs. So it's very important in terms of health to count with the community support and understand what the community wants and can do. What are the priorities for the community, and work with the community. The communities need to just start taking decisions. And for that, they need obviously training and skills and all of that. That has been a way to think that the health can be improved for different communities. Obviously, more advocacy actions and more policies that support a better environment that can start changing these aspects. And maybe more things. So this is everything is about creativity. What else can be done? And there's no one single thing that needs to be done. It's step by step, and sometimes some actions can improve one situation. Let's say food, but it's hard sometimes to cover all. But if everybody would be working in different areas, it can be. There's hope. I believe there's a lot of hope. Let's see. The last part is the community health factors. Basically, these are interesting areas to see, to understand the health of the people. When we think about the place is the physical environment in which people live, play, work, and go to school. Then we have people. What kind of relationships we have access to? Do we live in a place where we don't know anyone, nobody cares about us, or we live in a place where our social relationships are strong and healthy, and we live with our own positive people or our own dangerous people? You know? Opportunities. What is the level of distribution of opportunities and resources? So these are very important areas. So the place. How is the place? Low-income communities usually have 25% less supermarkets than middle-income communities. That's when we think about eating better, you have already an environment that is not helping you to eat better. Poor people and people of color are usually have access to neighborhoods where less public and private investment takes place. Same thing goes when we think about security. Police, how the police reacts when there's a shooting in a Latino neighborhood, for example, or if there would be a shooting. Usually there are not too many shootings in a high-income neighborhood, but how the police would react in both cases. And usually what happens, and I know this because the people tell me about these stories in the South Side, when there's a shooting in the South Side, they call the police, and the police arrives 1 to 2 hours later. So after everything is done. And the same I witnessed in Los Angeles, because in Los Angeles there's so many gangs and a lot of crime and fights between gangs. What is the security for these families depending where they live? And when you think about physical activity, you want to exercise outside. That's kind of the ideal, right? Low-income neighborhoods usually have fewer unsafe, they are not nice parks where to do exercise. Maybe there are parks. Are they nice? Do you really feel motivated to do exercise? Because Tatiana told you that you need to do exercise, but you see a park which is 10 blocks away from your house, do you feel like you're going to do exercise there alone? Nobody else is doing exercise. And that's something that happened with Cindy, the daughter of Edith. When they were driving through the lakefront, and Cindy told her mom, "Mom, look at all these people. They are all doing exercise. They are running, they are using the bikes. Why can't we live in this neighborhood? I want to do the same. Look where we live. It's all ugly. Nobody runs." And Edith told me that, and she was really sad because she just could say, "I can't afford to live in this neighborhood," right? So that's the situation. When we think about physical activity, many people say, "Oh, people, they just need to exercise. Why they can't? They just need to eat better. Why they can't?" You know, it's an issue of, it's a personal responsibility. You just need to do it. Is this a place that is motivating you to do that? Hispanic children have a 40% higher pedestrian fatality. You know, so if we think kids should walk more, okay, there's a risk in walking in a Hispanic neighborhood. And usually people of color, they have 27% more toxic chemicals exposure and 32% higher risk of cancer because of where they live too. This is the Kinnickinnic River before the cleanup that took place before. Opportunities. In 2007, Latino families earned 62 cents for every dollar earned by a white family. And then we have youth of color are more likely to be taught by inexperienced teachers and receive harsher discipline. And that's something that we know too. Mm-hmm. This is the last one I have in this to understand the people. Black drug users are nearly 20 times more likely to spend time in prison for the same thing than a Caucasian individual. And sometimes it can be 20 to 57% more incarceration time. For the same, or it can be, the whites can have even a greater drug violation, but you can see the incarceration time can be higher. So if not this, what does an ideal neighborhood look like? It's a neighborhood where everyone has access to the same opportunities for good health and fulfilling and productive life. That's the definition of health equity. That's what we are looking for. That's where we're going towards. I want to leave you with this quote that I think really has a relationship with the work that Civic is doing. We're all standing on the bank of the river rescuing people who are drowning. We have not gone to the head of the river to keep them from falling in. That's a 21st century task. So I think that's where we are trying to move. I think this group is really trying to move towards this. We're not thinking just in terms of personal responsibility in people, and that's why I believe in this group. Thank you.
There you go.
Yeah.